for this piece in the journey and then continue the journey in other ways. Mark.
So good morning, good afternoon, good evening, everyone around the world. My name is Mark Richard Muller. I'm the Executive Director of the Academy of Applied Myofunctional Sciences. In our little short history, about 6.5 years ago, we had our first meeting, our first scientific meeting in Rome. We've had about 20 meetings around the world. This is our 5th Congress, which means it has a membership focus. And as some people out there in the audience know, we were planning on having our 5th Congress in Paris the end of June of this year. And then in February, I was working in Europe a little bit, and boom, I saw this coming wave, and I called an emergency board meeting, I think on the 26th of February. And I said, we have to change, we have to cancel our live meeting, even though I loved the idea of the French Automobile Club, Place de la Concorde, having a gala at the Cercle Inter Alliés.
Yeah.
Oh, extraordinary. The Gardens of Paris. I want to give a thanks to Louis Vuitton Moet Hennessy, which was very considerately offering to be a sponsor with some of their luxury brand lines like Moet and Chandon and Hennessy. And I was going to make a run at Ramova.
Well, we're going to look forward.
Anyway, so here we went. We pivoted. We're like, we're going virtual, baby. We've got to do something to reimagine what we're doing. And here we have Virtual Reimagined, the 5th AAMS Congress. And it's really been such an extraordinary event. Over 150 speakers now. We actually 175. We just did the math last night, preparing for a film today.
Wow.
During our closing ceremony. And
That's
over 150 presentations. Our public-facing fora, 9 of them, have been seen collectively hundreds of thousands of times. We've had a couple million page views, and we just gave up counting in different, social media. And then we have until October 1st, because it's coming Thursday, our Congress is still going, active, full-blown, scheduled public interaction. And then we're going to pivot and convert on October the 2nd. For those who care to join our society, I think the entry membership level is $200. Unless you're a student, then it's like much lower. And you can enjoy the features and benefits of the Congress until December 31st, another full 3 months.
And I know a lot of you have been writing me personally saying, can we have extended time? I couldn't fit it in. There's so much that I want to see, and I've got to homeschool my kids, and I do this on weekends, and believe me, I relate. And all we want to say is please become a member. It's $200 annually, and we're going to bring more and more benefits to you. But the first benefit are these extended viewing access privileges, and you get all that time. And also, we are just going to announce officially, we have AGD CEUs available. If you think about all the time that you're able to rack up, there's a lot of benefits to extending the time, and you'll get AGD CEUs, and I'll explain how to do that at the end.
So this is our closing panel. We are officially closing the Congress today in terms of live content. What will carry forward into next month, November, December, beyond, our member activities, committee meetings. We've got so many robust activities, great white papers. We have work. We have 4 new scientific societies to announce during our closing ceremony, which will be black tie. There'll be a little wardrobe change, which will just be at the top of the next hour. So 10 a.m. Pacific time, Los Angeles, 1900 hours Paris, Central European time. We'll have 2 Lifetime Achievement Awards, 3 calls for action. We'll have the announcement of 4 new scientific societies and 1 foundation. And it'll be a lot of fun. It's a cocktail reception as well. So somewhere in the world, it's cocktail time. And so we will be celebrating that. But we have our panelists here today. As everyone can see, if you've looked at the artwork, and if you haven't seen this program, you can get it on our Facebook page, both in the Congress and public. And it has images of the modeling of the aortic valve dynamics. So heart opening and closing. So we have a closing ceremony, a closing panel discussion, and yet look at this Qigong heart just exploding behind these heads, just like boom, hearts opening. We've hit a tipping point, people. This is exciting. So we invited on a select grouping of all-stars from the Congress representing, you know, most of the tracks. And we're gonna just run through this very quickly. So we asked 3 questions of our panelists. What do we know? What did we learn, as in the course of this Congress? What did we learn? Where are we going? What is next? Where are we going? So if we could just, you know, we're gonna run through it in the order here. Patrice Bergeron is at a kids party. He's gonna be jumping in a little bit later in Switzerland. He's at a children's party in Geneva. So we're gonna start with Giedre Berchin Felix, who is the recipient of our AAMS Hippocrates Gala Lifetime Achievement Award, Madame Marie Curie Award for Lifetime Achievement in the Advancement of Medicine via Science involving myofunctional therapy. So Giedre Berchin Felix is a professor at University of Sao Paulo, Bauru, which is one of the leading, I think, institutions in the world for orofacial pain, for sciences, for craniofacial surgery, and for myofunctional therapy. Thank you very much, Giedre, for your contribution with not only a half-day workshop, 3 presentations on groundbreaking subjects in 2 different tracks, and a lot of wonderful participation. So thank you for your vision and leadership, Giedre Berchin Felix.
My pleasure. Thank you a lot for this amazing opportunity to learn with you and other professionals around the world who are studying and researching a lot. Thank you very much for this opportunity. May I share my presentation? Yeah?
Pode.
Okay. Okay, I will talk about the myofunctional therapy and trying to answer the three questions that we have to talk about today. And we know a lot of anatomical and physiological aspects of the stomatokinetic system, especially because of the advance in the instrumental exams. And we also know a lot about the cause and effects relationship, the relationship between morphological characteristics of the stomatokinetic system and orofacial functions. Then we can know if the patient presents a disorder or an adaptation. It is very, very important. We'll also learn a lot about the validation of the automyofunctional assessment and about protocols. I talked about one of these protocols, but we have more of them. We have general protocols, and we have protocols adapted to elderly, to patients with apnea or cleft palate. Then we learn about this in our researches in Brazil, and some of these topics was presented in this Congress. Also, we learn about new professional practice areas, not only in the dentistry area, as like the temporomandibular disorders or oral rehabilitations, orthognathic surgery, but also about the apnea, the assessment of the tongue tie to identify tongue tie, and we have new areas to spread, for example, about patients undergo to the bariatric surgery. And where we are going, it's very, very important to understand better the exercise physiology applied to orofacial myofunctional disorders to prove the efficacy of the myofunctional therapy program, because we have to understand better the the organization of the auto functions in the brain, the neuromuscular memory, and in order to provide better programs and to prove the efficacy of the myofunctional therapy. This is, we are working with muscle exercises and with the functions of breathing, swallowing, chewing, and speech. And our role is very, very important. This is my short presentation. Many, many thanks.
Thank you so much, Yedra. You know what is so wonderful is that you bring us all to the table, and whether you are in France or Japan or Brazil or here in America, we all are looking at the same topics, and that's what's making this really a collective movement forward. And just the way that you did that is so helpful for everyone. So very helpful. Thank you so much. I agree with you. We need a lot more exercise physiology understanding so that we can really tailor these exercises and get them pinpointed to serve or the phenotypes of populations. So it's wonderful to have you here.
Muito obrigado, Jedre.
Muito obrigada, muito obrigada. Thank you a lot. Sorry for my Portuguese English.
Oh,
No,
adoro o
great.
seu português.
Sim, sim.
É ótimo. So I want to welcome our next panelist, Katrina Rogers. So beyond being on our board as an at-large member for the Academy of Applied Myofunctional Sciences, she is also this Congress, 5th Congress, Congress Secretary, and she's a recipient of Winston Churchill Memorial Trust Fellowship, a Queen's Charity, with her remit to explore how to put myofunctional therapy into the National Health Service, the NHS of the UK. Thank you very much, Katrina.
Thanks.
What did we know? What did we learn? And where are we going?
So thank you for inviting me to the panel. It's been an extraordinary journey to support the AAMS, to be secretary. And for me, being secretary, I've connected with so many of the speakers, which has just improved my thinking around this topic. I work with predominantly children, but also adults. And in my clinical work, for me, myofunctional therapy works. It changes people's lives. Having connected with so many speakers, I've had opportunity to learn about the diversity of the work extensively, and having done part of my Winston Churchill project to connect with people in action. So seeing work live, connecting with patients and learning from them. And actually, I think to join with Jedra, we know this works, but specifically we need to pinpoint and drill down actually which bits are effective, and to recognize the phenotypes, and also to connect the dots. So to think about, for me, working within the field of dysphagia, but also listening to our patients and thinking about what other difficulties are there that are connected to the stomatognathia system, affecting sleep, affecting breathing. And just today I was working with a little boy who I've been treating, who has dysphagia, and poor speech. He has a significant tongue tie, and his mum having put into practice many of the exercises, his behavior, his attention's changed alongside his eating and drinking. So, you know, interfacing in that way. But for the mum, she wasn't aware of that when she met me. She wasn't aware of the power of this work. So I have been very keen to push this forwards into the National Health Service, and I feel that we need to spread the message out there, to share about the successes, to share about the specific markers of where this work can really support our patients and improve health. And we're really looking at the whole age range from naught to older people, to connect with them. And it's just been a joy to learn from all of you, and brilliant speakers. So what I would say is that we do need to think about multidisciplinary team working. We need to think about sharing with our patients, exposing our work, so that we can prevent as well as treat. Yeah, that's what I would say. But thank you so much for inviting me and to allow for me to contribute to the Congress. It's just been a joy. Hard work, but a joy.
For your hard work. I know how hard it is, because these are jobs that are done after you have a full day with PPE and seeing patients, and you know, your dedication and getting everything going. It's that propels this forward. So again, Katrina, thank you for everything you've done.
You're welcome.
I know we call you way too much during the day, so we'll stop
It's
FaceTiming
okay.
you every 20 minutes.
It's okay. It's okay. Having 3 jobs during COVID times, it's kept me entertained. But thanks.
Our next panelist I would love to introduce is Virginia Johnson, who is a doctor of osteopathy, osteopathic medicine, a professor, a teacher, a lecturer, and of course a clinician. She sees a wide spectrum of ages. Katrina was just talking about the lifespan, and it's just fascinating that this really does fit in from many disciplines across the lifespan. And Virginia, it's been such a pleasure to get to know you, and also your focus and interest in the tongue, and how the tongue propelled you to the creation of a thesis, which you delivered here, and understanding the lymphatic component of the tongue and what the tongue does as a pump and as an organ for the rest of the body. So thank you for your presentation. If you haven't seen it, you absolutely need to see her presentation. It's an osteopathic perspective on the function of the tongue and how it moves fluids through the body, which is really ever important. So thank you, Virginia. What did we learn?
Thank you.
Where are we going?
Yes, thank you. First of all, I want to congratulate you, Samantha, and Mark for putting together this amazing program, but for beyond that, for the inception of having a whole society, an international society. I have watched this group grow from what I'm going to call a moment of frustration into this absolutely wonderful world-class international organization that has pulled together so many wonderful people, outstanding researchers, outstanding clinicians. I think you have done a great service to human beings everywhere. This is just marvelous, and I can see it just keeps growing. The knowledge base keeps expanding, and you two really deserve a lot of credit for this, because you're pulling it all together and making it happen. So where, what do we know? you know, what did we learn? We're not just really talking about a mouth or a tongue. I mean, we're talking about a whole dynamic system of the human being. And we're looking at root causes of so many very distressing and puzzling diseases, suffering that people go through. I was happy to see in this conference that the question of obesity came in. I think the approach has always been backwards. Usually the obese patient is told to lose the weight and their sleep apnea will help them, and maybe they'll get some support with a CPAP. But the underlying functional problem that caused or led them to the obesity is not addressed. And I think we have a lot of people that give up because they're not being allowed to address the underlying root causes of problems. And it's a system, it's a problem that spirals, the tongue tie, the exhaustion, the apnea that results from it. They're looking for energy, they overeat, and they don't have the energy to exercise. And, you know, right off, I can think of a young man, he's a new father who had gained a lot of weight and so frustrated that, you know, he couldn't lose the weight and was hard on himself. And once he had the oral dysfunction addressed, he automatically began sleeping better and having the energy to exercise, and the weight came under control. So I was so happy to see that. You know, it's so much more than dental or sleep pathology, which are of course very important in and of themselves. But from my own experience in my clinics, as I see children that have chronic immune problems, the frequent colds, the sinus problems, the allergies, which then escalates the chronic tonsillitis, and then there's the sleep problem, and then they show up with attention deficit disorder problems. This is such a critical piece of healthcare, and it certainly deserves to be expanded. You know, where is it going? Is I think we're removing a lot of the silos. We're breaking down a lot of barriers in medicine. That systems shouldn't be put into boxes. It's not a pulmonary problem. It's not a digestive problem. It's a whole body functional problem. It transcends the traditional boundaries. So, you know, where are we going? Is I think we're just going to continue to look at the body more from functional physiology and pathophysiology, looking for causes of problems rather than treating symptoms. So, you know, you guys are on the way, and you're taking us forward to the future. I really appreciate it.
Really wonderful. And it really is a dynamic human body, but also this collective is such a dynamic group because we're learning and advancing together. We would not be here without you. That is just the essence of how the AAMS is moving forward. The interest is growing. We can provide curated events, but it's really the clinicians and the public that's really driving this forward. And the insights you bring to this, Virginia, are so true. The public health crisis of obesity and looking at these root problems, it's just, it's something that is really infiltrating every culture, not just first world countries anymore. So thank you for pointing that out. Thank you for all you do. And thank you for really helping the babies and everyone after age 20, 30, 40, 50, 60, 70, and beyond. So again, you're rocking it. Thanks. You wanted to introduce Brian?
No, Eyal.
Oh, next, I'm very happy to introduce Eyal Botzer, who, if you have not been able to join any of our events, he's really dedicated his life to helping babies and mothers and the dyad, and with over 20,000 actual Freenome release procedures, I think he ranks as one of the highest provider in the world. And Eyal, as a pediatric dentist, you have really been on this bandwagon early on. I know early in 2000 and even before that, your participation with tongue tie and associations to advance the knowledge has really been something that you've been so passionate about. So Eyal, from your perspective in Tel Aviv, you're joining us here from Israel. We would love to know where you think we are, what did we learn, and where is this going?
So thank you again and again and again for all what you are doing during this crazy 2 months. Don't know how much sleep did you have during this time. Well, what I've learned here a lot from all my friends that even in the field that I have a lot of experience in, not that 20,000 phrenotomies is the record and there's any fight over who's done more than the other. The fact is that we see a lot of patients, and a lot of patients are looking for us because they have problems. I've learned from each and every provider in the section of tongue tie, because everyone have developed their own unique observation and their own unique technique and way of looking, and it's great to learn from them. The fact that each and every one of us has so much more to learn. This is, I think it's a phase in the development of a physician. The more you know, the more you know that you don't know anything. So research is the thing that we are missing, and there is a lot of place for research. And where we are going by, I think, conquering the hearts of many other professionals that even had a bite from this meeting and understand, and sometimes they have their own personal cases and they see that, hey, this explains something to me that I've always been hearing about or looking, observing, and it didn't really click. And now let's go to this venue and understand it even deeper. So we have a long way to go, but you have done a great way so far. So thank you, and let's keep learning.
Thank you very much, Eyal. It's amazing to be on this journey with you. I remember we were renting a house when we were doing a little residency at Ichlag and University of Tel Aviv last year. I'm sorry that COVID prevented us from coming back again this year, but I loved staying in that area right off of Rothschild and Tel Aviv, nonstop city, 24-hour city. Woohoo! We love Tel Aviv.
Now we are under lockdown.
My son Nico said he became friends with the waves there. So it was a beautiful place and a beautiful center and a lot of really great things. And if you ever have Eyal over to your house, you get some good ingredients. He'll teach you how to make tahini, hummus. He just can't help it. He breaks it out. You just like pulls it. If it's around, the ingredients are out, just boom, it's happening.
Come again.
Okay, thank you. But I want to introduce our next panelist, Brian Krohn. It's been really exciting to begin this dialogue in the last year with Brian and his project. We had a technology forum. We've had several people speak about gamification, or how do we scale up, or how do we apply technology. I think when we realize the scope of the public health crisis we're in with myofunctional disorders, it becomes with so few people trained, even in terms of public awareness, it's going to start skyrocketing. You heard the numbers about millions of page views, hundreds of thousands of people watching our fora. We're going to have to figure out a way to scale this up. And, it's great to have bright people like Brian Krohn, others around the world, Harold, who we'll hear from next, Carlos, Rena O'Connor, or O'Connor Rena, rather, and some others around the world. Thank you for coming on, Brian. What do we know? What did we learn? And where are we going?
Awesome. Thanks, Mark. And Mark and Samantha, both excellent job on this very successful virtual Congress. Really appreciate all the work that you and the whole team have put into making this happen. So what do we know? I think that myofunctional therapy works. I mean, we've heard that across the panels. That was, and just kind of reiterating that. right? And what did we learn? What I learned from all these panels is just all of the amazing research that's going on across all these different disciplines. And you're starting to hone in, I think Katrina mentioned this, honing in on, what are the phenotypes and what are the specifics, exercises and things that work most effectively. So we know it works, but now it's what is most effective. And there's just lots of really good research going on to answer that question. And then, what's next is, like Mark said, it's bringing this to the masses. It's when you find out, like, can identify what somebody's problem is and what's going to work best for them. Then how do you deliver that, not just in a clinical setting, but at scale to the world? And I think it's moving in a really exciting direction.
Very much, Brian. We look really forward to the impact technology will have in research, in phenotyping, in clinical application. And Licha mentioned this term in one of our panels, democratization of access to care. Thank you. It's a real privilege to welcome our next panelist, who I'm glad wasn't called into emergency surgery, which was maybe going to happen today. Harold Fribo-Strom. Funny thing, we had for our institute, the AOMT, we had a kickoff little wine and cheese reception sponsored by the World Sleep Society at the World Sleep Congress in Vancouver last year. And I think he was already following myofunctional therapy, and he saw the sign. It was near the registration desk, and he's like, he wandered in. I was like, welcome. And it's been just so great, to get to know him. He invited me to University of Oslo and Oscar Hoos University Hospital and the Norwegian Sleep Society. We had some meetings in front of their research team there. They're doing such tremendous work at University of Oslo and in Norway and in these consortia that they're building across Scandinavia. We're really excited what you and your team will be delivering in the future, Harold. And what do we know? What did we learn, and where are we going today?
Thank you, Mark, for this wonderful introduction. I just also want to thank you and all of the organizers, Katrina, and in particular, maybe the graphical designer. This Congress has been filled with so many beautiful artworks. And this heart behind me, it's even for me as an ENT doctor, it looks more like a throat with a uvula than a heart, but I'm probably a bit biased. But to answer the questions, I think that all of us in this forum, all of the listeners here, we know that OMT works. However, it's a large number of clinicians, doctors, scientists out there that don't believe that this works. And that's a big challenge. I just finished my attendance at the ESRS Congress, the European Sleep Research Society, and it was very little about the orofacial myofunctional therapy. And even when I tried to discuss it in the panels and in the discussion rooms, these questions were mostly not answered by the senior sleep researchers. So we really have a challenge to make good research and to get this out to also the clinicians. And to answer what I learned so much, so it's hard to pinpoint some specific things, but I must confess that before this Congress, I was quite skeptical to the importance of a tongue tie. And during this Congress, I have been more convinced, especially regarding the importance for breastfeeding and feeding in early childhood. And that has made a concrete change in my priorities as an ENT senior consultant. So now in my department, we give higher priority to these children because of this Congress. And I think that's a good thing. I also learned a lot about really exciting new technology, like Brian's product and Carlos Econovaria, and also the Parrot and the IOP. So I really look forward to try to network these kind of new technology into some joint collaboration. And I also, the final thing I want to emphasize is that there is a debate about standardized orofacial myofunctional therapy versus the personalized thing. Because me as a researcher, I want to do things standardized, in order to assess the effect. But of course, a lot of speech language therapists that are out there, they say that every patient should have their own tailored intervention. And that's a very hard thing in research. So I hope that in the future that we're making fantastic randomized controlled trials together. I hope that we will be able to make a tech collaboration that will manage to do personal security in a good way, and also that we make standardizations that make it possible for us to collaborate between different innovations. So thank you very much, and I look forward to see you in person in the next event.
I look forward to meeting you too in person. I've heard so much.
We met in Vancouver.
We met in Vancouver.
So briefly.
And
not enough.
I think we're so excited to go back to Norway, and we were hoping to maybe come by this year with some coursework, but I think there's going to be some exciting things. I also appreciated your colleague Peter and the technology platform. We have some really exciting opportunities. We're going to have some announcements. For instance, we have a foundation that we're registering in the very near future. It's called the Patient-Centered Outcomes Foundation. And we have two different arms that we're in design phase around this. It's called myomd.org. And we have omdinfo.org. So there will be patient-centered groups where we can hopefully have these patients realize that they own their own data, they control this, and we can collect some really interesting information. And we look forward to this Norwegian-led consortium, and we're really excited about it. And there's some really great things coming out of the European Union as well, with this cloud, this sleep cloud kind of group, and Horizon 2020 funds. And we're really excited about things coming from Europe. And furthermore, in terms of the ESRS, thank you for mentioning that. You know, I've participated in and been a member of the ESRS, and, you know, I think a little bit like our American Academy of Sleep Medicine, you know, there are these kind of gold standards, you know, which there's a lot of investment in the business model and, you know, the clinical model around the lab or the scoring and this architecture of the algorithm that's used in the triage. And, you know, when you're talking about, you know, precision medicine and standardization, and, you know, that's such an important dichotomy when you're looking at research. But when you're looking at these, you know, major international or national organizations where they're large ships, I think we need, as an academy, to look, how can we, you know, offer fruit and continue to engage and impact. And we're so lucky that we've had such welcome outreach from other international bodies like the World Sleep Society. We have some great announcements coming up where we're going to be partnering in several meetings with them. Coming up in Rome in 2022 and in Brazil in 2023. And there's going to be some other opportunities to discuss some crossover. So stay tuned. In just about 20 minutes, we'll start our closing ceremony. But there are a couple of other people we want to say hello to. I see Shannon Sullivan is joined us. Thank you, Shannon. Are you able to come on with your camera? Is your bandwidth a little low where you're at? Can we hear you?
I'm happy to join you. I'm so sorry I can't get up my virtual background, but if you don't mind.
Oh, that's okay. So Shannon has contributed so much to this Congress and been such a wonderful advocate. Just a little anecdote from her about her. You know, while being a leader in sleep medicine and pediatric and pulmonary care at Stanford, and also in their fellowship, she took it upon herself to do a sabbatical at University of Rome Sapienza and Ospedale Sant'Andrea, where they've been working with myofunctional therapy for a number of years, to kind of continue her personal investigation and journey and mission. So she's a great advocate for children's issues and a great scientist. Thank you for coming in. And what do we know? What did we learn? And where are we going?
Well, I just want to say a quick word of thanks to everybody on this call, but especially to Samantha and Mark. This has been an incredible journey and an incredible example of the importance of collaboration. So both personally, as you mentioned, being able to reach out to colleagues in other centers in other countries and learning about being able to learn how to deploy these types of ideas in practice and then bring those back home has been important clinically. But the discussion you were just having really speaks to the importance of being able to reach across different professional societies and organizations to really be able to move this field forward. So thank you again. It's been wonderful.
Thank you, Shannon. I think that's exciting to think about, collaboration, strategic engagement and alignment with different bodies, scientific bodies, clinical bodies, and academies around the world. I think those are so important strategically, and it's been a real kind of strategic emphasis for the AAMS in its little short time on the planet. We have a couple of other people. I see my mother, and in order to be a good boy, we have the Jewish holidays right now. It's Rosh Hashanah, Yom Kippur starts. I love you, Mom. Anyone out there in the world who I may have stepped on their toes or caused anyone any upset, please forgive me. Yom Kippur starts tomorrow night at sundown. Mom, is there what do we know? Joy Moeller, what have we learned and where are we going?
Oh,
you're muted, Mom. Mom, your sound, you're muted. You gotta.
All right. So the biggest thing I think I learned is that after 40 years of doing this, it's actually happening. And I feel the support of all of these professionals that are not throwing rotten eggs at me anymore and just accepting this as a legitimate, amazing treatment that can help so many millions of people, especially with early intervention with infants and all the way up, because the horror of seeing patients every day that have been mutilated and medicated, over medicated and over surgerized, and then to think that we are getting closer to a legitimate solution to prevent this problem is just beyond my wildest imagination. And thank you, Mark and Samantha, so much for this. So the biggest thing I've learned is that it's happening and it's exploding. Thank you.
Well, I want to give a collective thank you to everyone here. We are going to just rock it in 15 minutes from now. I hope everyone takes a little break, maybe a little wardrobe change. We've had a call for black tie optional at our closing ceremony. We have Darius Logmani who's joined us. Darius, you want to say something about, he's the director of sleep at Advocate Health Systems, the largest private health system in the US with about 40 hospitals and about 3,000 clinics. Darius, what have we learned and where are we going from here?
We learned that I'm standing between people and their break. So so I'm going to keep this real tight. I think the thing that has become really obvious is there are strong relationships and a lot of enthusiasm for everybody that joins in answering the questions that we've identified in these spaces. So spaces like this where people can meet each other, identify common questions and collaborate. I think everybody that comes into these spaces feels that enthusiasm and that energy. I mean, I met Brian Crone last week. We submitted a grant yesterday. So I mean, these are things that like it just always happens. So we're grateful for these spaces, and the more that we can identify, we come together to answer questions, and instead of trying to argue about technique, the more we'll find that there's room for everybody, right? So we're grateful that you create this space with this energy and these and just this kind of environment of collaboration and enthusiasm. So thank you guys. Thank you guys for including me.
That is so awesome to hear. I love that. Cross the aisle, connecting. And if you're just joining the Congress, let us remind you, while the viewing is going to continue for members, you can become a member and stay with the AAMS and watch these incredible presentations, because I can just tell you right now, you will learn so much. Even if you are at the top of your game, there's always something new from a different perspective and a different person bringing in that information. So I want to say thank you to everyone here. Thank you to the AAMS. Thank you to the membership. We're going to take a brief break, and then at the top of the hour, please come back. We have important announcements, and we're also going to talk about how you can get your CEUs, and also any other things.
Yeah, we're going to talk about the 6th AAMS Congress, which will take place.
Just cliffhanger.
Oh,
Let them
cliffhanger.
Come back for the
Well,
information.
you know, they'll learn more. It's called Virtual Beyond. A hybrid. We have 10 cities with live symposia already confirmed, and we will have even a bigger offering August 1st to October 1st of 2021. So join us for more details. Great Lifetime Achievement Award for Shelly Marmette, the woman. She's kind of like my aunt, so in full disclosure, but
She is.
she's conceived of and helped create the field of lactation consulting, as well as their international board. And Jean Dallaire, just a remarkable human being, a visionary leader. We have a new award in his name. He's 97 years old. And we have awesome, exciting other news. So like the founding of a new society that just got registered in Geneva 2 days ago. Nope, 3 days ago. Anyway, so stay tuned. I'll see you in 10 minutes or so. Yep,
Top of the hour.
13
We'll see you.
minutes.
And please, we want to see you. If you're going to get dressed up, take a little shot of yourself, because we're going to include it in the closing video.
Post it on Facebook.
Please, we're asking you. Just take a little shot of yourself. It's really energizing and everyone loves it. So,
www.facebook.com/AAMS-info.
okay. See you soon, everybody.
Ciao, ciao.
Hey, Patrice? Patrice, can you hear me?
Yeah, how are you?
Hi, Patrice?
AAMS Congress.
Welcome to 5th AAMS meeting.
Welcome to the AAMS.
Welcome to the 5th International Congress of the AAMS.
Welcome to the AAMS 5th Congress.
AAMS 5th Congress online.
Virtual Congress.
1,000 welcomes. Near Fortune, or 100,000 welcomes to the AAMS 5th Congress.
Our first goal is to symmetrize the maximum.
And so the tongue is able to rest on your palate.
It's not going to be good, is it? That was just 3 years later.
Of the book Breath, The New Science of the Lost Art.
Do you like the ducks? He was fed for as long as 3 years.
So bad it's not able to walk, not run. The quality and quantity of these movements
is to remove the epiglottis. There is one option.
Now finally here on the right, we have a patient who is thin.
I'm excited to tell you that the future is now, and I'm excited to be part of it.
We are in this together.
We need to work together.
Let us work as a team.
We are a team working together.
Collaboration in the world.
Collaborative teamwork and coming together.
ENTs, OMTs, and orthodontists need to collaborate. Our children's health depends upon it.
Hello, everyone. Welcome.
Good evening, good morning, and good afternoon. My name is Mark Richard Muller, and I am the Executive Director of the Academy of Applied Myofunctional Sciences.
And my name is Samantha Weaver, and I am the co-chair of the Academy of Applied Myofunctional Sciences.
5th Congress.
5th Congress.
Virtual Reimagined, which we are wrapping up here today with this closing ceremony. This virtual reimagination of what it is to have a Congress program. So this is also a cocktail reception. So I don't know if you have your cocktails ready. We have a bottle of Palmeraie chilling on ice here. And we have a tiger knocking on a window behind us here as we're in our little virtual studio in the United States of America, Los Angeles. We have, gosh, we're going to roll through some numbers here. We have a little film prepared at the end of this closing ceremony. We say opening because you may see the hearts there. There was some artwork that we had for our program for our closing panel discussion which referenced a little bit of an aortic valve. I see your Corona there, Mr. in Tel Aviv. That's a Mexican beer. Where's your Maccabee? Anyway, we have a really dynamic lineup of activities, of ground to cover. So just to lay out some things here, we have 2 Lifetime Achievement Awards. Whoa! Wow. Sorry, we have hot lights here in the studio. You cannot see that. I'll pour some champagne. I guess there's a little indication here. We should get busy, get on with things. So thank you for those who have decided to have fun and dress up here in our COVID pod quarantine. We have a little bit of a, abundance of wealth here. We had about 45 speakers, including panelists, who were going to participate in our Congress, such as it was when we were going to have it at the Place de la Concorde, the Automobile Club of France, which is an extraordinary venue right in the heart of Paris, which we love, and have a gala, AAMS Hippocrates Gala at the Cercle Inter Alliés. We had an extraordinary lineup, a satellite symposium planned at the Center for Research in Interdisciplinarity the day after. So 5 days of programming, extraordinary stuff, and then boom, coronavirus. In February, we pivoted very quickly and we worked on reimagining. So thank you. It seems like everybody seems excited by the format, and we now have over 150 speakers in 9 symposia tracks, and it's been extraordinary. The tipping point we feel here. We may see an icon here for in the gallery view for Platform Media Group. We've just brought in an old dear friend of mine, Henry Eshelman, who has a boutique public relations firm, which has done extraordinary work for film, for public advocacy, for foundations, and also for large brands you may have heard of, like Vogue or Hyatt. But Henry, I'm going to call you out on the spot here in your new role as a public relations advisor. What do you perceive in your baptism by fire and jumping into looking at what we're doing here? You've got to unmute yourself.
I'm not going to take the bait. I've been watching you guys for the last month and really just trying to learn about what it is that you do and what you stand for and what your practices are, with an eye towards taking that to the public and to the media worldwide as time goes on. So really, I'm a watcher and a listener, and I'm not a scientist, but I played one on TV, as the expression goes. So anyway, I mean, I've really enjoyed sort of observing people's behavior and what it is that their practices are and how they're planning on taking it to their patients and to the clinics and in the medical field. So I'm sorry it's not a terribly articulate speech. As he said, I was unprepared, but really it's just nice to meet everybody and to listen to you and to hopefully learn enough to credibly represent you all to the public. Thanks. And I did dress because he suggested that I do that. So I got out an old Thomas Wilde ascot. Literally my tuxedo is in the garage because I don't wear it very often. Anyway, please let me yield my time back to Mark. Unmute yourself.
So unlike Mark to be muted so long.
I sympathize with him. My voice is a vacuum as well.
Oh, but it's not laryngospasm.
Inside joke.
So we all will take a glass of champagne to wait. Mark is coming back with Samantha. But really, I don't know if you hear me, and Kevin, if you hear me, it's really a pleasure to be with you on this society and with all of you, because the EPOS, the International Pediatric Orthodontic Society, was something on our mind, and we decided to do it, and you all help us to do it, and really because it's our job, it's what we are doing. And I love, because I don't know the AAMS before, I know the myofunctional because we have many people who work on the tongue, to change the form of the patient. But really, when you are an orthodontist and you do it for 20 years or 25 years, you treat the children and you see the result, and all the result, only the orthodontic result. But now with the myofunctional therapy, all the result just with this kind of treatment, you say, yes, why no people are doing it in the world? And at the end, you go to the AMS and we see so many people like you, and you are doing the same job, you are the same patient, and we are all the same patient, and it's not so easy to be together, I see, because we are our clinic, it's what I say to Mark, Mark is a patient guy. He's always pushing, but at the end, we have our own family. I have my children. It's like pediatric, and we have the clinic because we are dentists. We see many patients, and when you are doing the orthopedic pediatric treatment, it's crazy because you have more more patients than the other people, because the people can see the result on the face of the patient, and it's what I say. It's what I say to Mark, because when he say air is not air, food is not food, sleep is not sleep. So I'm agree with that. But at the end, I say yes. But the consequence is that the face is not the face of the patient. The face is changing, and we see so many patients now in the street, when you do this kind of treatment, and you see the face is moving. And I say yes, it's like an handicap, Our mission is to say to all the people in the world that we have like a handicap on the face of the patient, on the children. So we create on this world an handicap, and we need to explain to all the people in the world that this handicap is changing the vital capacity of the children. Because if you look how we are living, we take the energy only by the maxilla, the upper maxilla, the lower maxilla. So in the same time, you see the function, because when I speak, it's my function. I need to swallowing and I need to breathe, but all is on the maxilla, on this part of the face, and the AMS and now the IPOS really are on the job to focus about the function and the bone, not only the teeth, Like when you do orthopedic pediatric treatment, you don't care about the smile, the smile is giving after, The more important is not to align the teeth, It's just 10% of our job when you are an orthodontist. But if you want to achieve all the results when you are an orthodontist, the only way to do at the beginning, when you do a treatment for the children or the kids, they are 12 years old or 14 years old. If you look really about the face, not about the occlusion and the alignment, but you look about the face, the function, you're never happy. There was only way to be happy is to begin.
Patrice, can you hear me?
Yes, we hear you.
Oh, beautiful. Okay, yeah. So
but you finish your glass of champagne, no?
Bergeron, he is an orthodontist in Geneva, Switzerland, and he is the founding president of the International Pediatric Orthodontic Society, co-president, along with Dr. Kevin Boyd. So we're going to talk a little bit about that, but I just wanted to talk about the agenda we have for today. We are going to, maybe we should move into the founding of these associations. Do you have the, Ren, do you have the film for EPOS queued up? We have 4 different nonprofit scientific societies and one foundation we are going to announce today as a part of our closing ceremony. We're going to give 2 Lifetime Achievement Awards. Are we ready for the Lifetime Achievement? Maybe we'll start with Jean Dallaire. Is that ready? Okay, so we have some other activities. We're going to announce our next 4 congresses for the AAMS. And also this wonderful concept of a scientific society, the International Pediatric Orthodontic Society, that the AAMS will be incubating for its infancy and toddlerhood. You know, it's a little baby, a little baby. We have several board members here on the call today, including our vice president for research, Dr. Paola Pirelli, who's here from Rome. We have the founding president, Patrice Bergeron, and the co-president also, Dr. Kevin Boyd, who just crawled out of the Atlantic Ocean on Long Island, where he had a surf lesson with his daughter. So thank you. And we have Katrina
It's on
Rogers.
Queens. It's not Long Island. Queens, Rockaway Beach.
Oh yeah.
Rockaway
Here I
Beach.
am.
Okay,
nice
not
to
quite-
see you.
Technically, it is Long Island, actually. When you talk about Brooklyn, Queens, you're already on Long Island, man.
Okay, I'm not a New Yorker.
Okay.
Dev, you're a rock star.
A Rockaway.
A rock
Rockaway Beach
star.
Also, y'all both.
Yeah, that is awesome.
Go get more beer, most likely. We have an all-star lineup, which will send us off into the ethers very soon. Do we have those films queued up? Okay, so our first item here, we had an award we wanted to give during our virtual AMS Hippocrates Gala, and that was for Jean Dallaire. And we wanted to have an award actually named after him. So we'll talk a little bit about that. And we will have a glass of champagne. So I will make a toast to everyone here in this room and also around the world. Here is to, it's an old toast that we started early on at our first scientific meeting in Rome. Actually, we had a pre-Congress in Chicago, April of 2014. Here's to changing medicine, but with style. Why not? Right? Cheers.
Cheers, everyone.
Cheers, everyone.
Cheers. Cheers.
Gallery, everyone cheers.
Cheers, cheers, cheers.
Cheers, cheers.
Okay.
Yes.
So Jean Dallaire is 97 years old. He lives in Nantes, where he's a longtime professor. He comes from a class of kind of scholar clinicians that are called stomatologists. So really the objective really is thinking about becoming an orthodontist. But in order to become an orthodontist, they first become a medical doctor. Then they become a dentist. Then they do a residency in orthodontics. Then they do advanced work, or maybe, if you would, a doctorate type work in stomatology, which is the science of chewing, breathing, swallowing. There are very few of these traditions around the world, a little bit in China, where their medical system was envisioned by some pioneers from Germany, their Western medicine, I mean, in the 19th century at Peking University. So they have a little tradition in China, which I think lends itself very interestingly to Asian medicine and acupuncture, other principles. But we look forward to great things coming out of China and the People's Republic of China, where we have a fledgling movement to form a scientific society underway. And also really in Germany, in Spain, and most certainly in France. So Jean Dallaire, I know Christian Guilleminault, when he was a resident in Paris in the 1960s, found his work and found it inspiring and really was amazing. And I know Dr. Paola Pirelli would like to say a few words about Jean Dallaire, who she knew and was inspired by him and his work. So Dr. Pirelli, our longtime friend and our founding vice president of the International Pediatric Orthodontic Society. Thank you for coming here straight from a Congress.
So, thank you, Mark. I'd like to thank Mark Miller and Samantha Weaver, the organizer of this fantastic conference, for the invitation to speak in honor of the great Professor Dallaire. I'm really happy to have this special opportunity to give my testimony regarding a truly effective therapeutic treatment. When I started my practice as an orthodontist in 1984 in USA, where I was studying in orthodontics, so after my degree in Italy, I was in Boston University, one of the best schools all over the world, the Dallaire mask was not used. But we have to remember that in USA, the percentage of children affected by class 3 malocclusion was very low, while in Italy it was really higher. And I absolutely wanted to help these special children. So I deepened my study in Europe in a special way with Dr. Elsa Di Malta, a very close associate of Professor Dallaire in Nantes. And treatment of skeletal class 3 malocclusion, you know, is one of the most challenging orthodontic corrections. The potentially unfavorable growth pattern of the patients affected by this skeletal discrepancy usually requires effective and early intervention. At that time, very few of us adopted this treatment. And really, I was alone. It has been difficult for me at that time. They were thinking that I was a little bit crazy. My experience of over 30 years of research and clinical practice is that the orthopedic therapy with the Dallaire face mask is really effective, treating successfully growing class 3 patients. The issue is the early diagnosis. It's fundamental to start the orthopedic therapy as soon as possible, taking advantage of the craniofacial growth potential through the activation of the craniofacial sutures. You know, I did a lot of histological research on the suture, and in my opinion, the Dallaire mask is the ideal way to achieve the best results. So, International Pediatric Orthodontic Society has been created with the intention of promoting knowledge of the importance of early treatment of children affected by malocclusion by orthopedic treatment in association with myofunctional treatment. So this collaboration is really very important. So to conclude, as the IPOS Vice President for Research, and I thank all of you, I want to deeply thank Professor Dallaire for the immense contribution to the treatment of the worst malocclusion in children. Treatment that allows to avoid very hard problems, needing maxillofacial surgery, a lot of problems. A treatment that gives children the opportunity to live their infancy in the best way and to grow correctly, improving their health for all their life. So thanks a lot, Professor Dallaire, for your precious work. Thanks, EPOS President and all the board. And finally, thanks all of you.
Grazie mille, Paola. Paola Pirelli, if you don't know, is a giant in medicine herself and a pioneer, a visionary pioneer in orthodontics, having really done the early pioneering work on rapid maxillary expansion as it relates to sleep apnea. So really a visionary in how to do intervention in children who suffer from maxillary hyperplasia, mid-face hypoplasia, these kind of really dramatic craniofacial, you know, kind of dysfunctions that result from mouth breathing, from low tongue posture. And what's that term, Kevin? Malocclusion? What is it? Craniofacial?
No, craniofacial respiratory, you know, insufficiency.
Okay.
Is that the craniofacial midface complex is intimately connected to the respiratory complex. They should never, ever be discussed as separate entities, nor should breastfeeding and weaning. Those things always need to be talked about together. So thank you for bringing that up, Mark.
Thanks, Mark, for all your kind words, and thanks all of you. What's happening, Kevin?
Am I supposed to be talking? No, he asked me one question. This is your spotlight, Paola. I mean, I
Are you
did not know.
speaking to me?
Kevin, Paula, 1 second, please. You
Yeah,
guys mute yourselves for a second.
was, yeah.
So I'd like to announce the formation of the Academy of Applied Myofunctional Sciences Jean Dallaire Premium Non Nocere Award for lifetime achievement in the vision and execution in the service of humanity via myofunctional sciences. Premium Non Nocere is Latin. It's Latin nocere is Latin for first do no harm. Really, so many interventions we have around the world do harm. And Jean Dallaire, it's been a privilege in the last couple of years to get to know him. I actually went with a team to his clinic before he packed it up, and his library, his research center in Nantes. And I got to spend time with him. We interviewed him for several hours, and he is such a passionate, caring gentleman. But he's a man of arts, of literature, of fantastic, scope and vision. He's tirelessly gone all over the world. His rooms are filled with trophies and awards from, societies in Peru, in Singapore, in Australia, in Germany. He's really a giant in medicine. And it's a privilege for us to be able to spotlight his visionary work and leadership. And I should say, in disclosure, my our oldest son, August, is been prescribed a Dallaire mask, and we're looking forward to applying that. But if we could run the film, we have a little a movie here. So I'm going to talk over this. This is the name of the award. His office has so much artwork. He's been inspired by so many people. We staged a multi-camera interview. As you can see, we didn't quite get the framing in an optimal format, but it was really an amazing time for us to go and spend time there. We went with Dr. Patrick Fellis, his son Guillaume Fellis. There's a picture of Jean Dallaire very early on. One of his many works, the development of skeletal craniofacial. There's some of his books. He's donated several of his library books to me personally. And I would love to find a library to house his tremendous collection of works. These are unpublished manuscripts from Harvold and Moss, Melvin Moss and Harvold. He's got such a tremendous amount of work there. It's animal skulls, children's skulls, fetal skulls throughout the last several hundred years, boxes of skulls that he's worked on. He doesn't stop working, really. He's such a tremendous visionary. He sends his regards and his regrets for not being able to come on this camera person. So these pictures, these are some of our meetings, our research discussions. I mean, he's just like so full of great support for the work we're doing in the AAMS. And here's an example of his interest in poetry, his championing of people socially, intellectually, artistically. He's really a giant. And giants in art have come and found him. There is his assistant. There's Steve Andrews, a friend of mine who's a filmmaker who assisted. There we are going out to lunch. We had a great little canteen, one of his local spots, which is has a Michelin rating. Nantes is a great city to visit, and it's really a privilege and an honor to be able to spotlight him with the name of this award. If you could pull up a glass right now, we'll make a toast to Professor Jean Dallaire. Your vision and leadership in the advancement of medicine. And I congratulate you on being the first recipient of the AAMS Jean Dallaire Premium Non Nocere Award for lifetime achievement in the vision and execution in service of humanity via myofunctional sciences. Thank
Bravo.
you.
Jean Dallaire.
Vive
Dallaire.
Jean Dallaire.
Whee!
Bravo.
Mhm.
So if we could pull up the slide presentation at this point. Is it queued up? So do you have the slide presentation, guys? We have a little bit of a technical question and answer period here. The 8 slides, yes, but plus these 2 should be in there too. They're first, right? Yeah, pull them up, please. So we have a couple other announcements. Do we have a film for Shelley Marmette yet? Okay, but we have an image. Are you able to pull up that presentation, Victor, or should I go on? Oh, there we go. So here's an image of the award, a picture of Jean Dallaire. You know, it's really, I look forward to sharing. We have about 6 hours of interview footage. You know, we will be working to put together, actually, Samantha and I have a film and television production company too. And we have about 150 interviews with people in and around the world in medicine. So we're looking forward to putting that together in a format that we can deliver to the public. If we could go to the next slide, please. The other person who is getting a Lifetime Achievement Award is our dear friend, an angel, really. She's like my aunt. She's one of my mother's best friends, Shelley Marmette. If you want to go forward with this.
I do, because Shelley Marmette is actually the person who conceptualized in 1997 and pioneered the profession of lactation consulting around the world. She also began the board and the certification process, began the master's degrees, bachelor's degrees, and now we have over 35,000 lactation consultants around the world in over 105 countries. So with Shelley Marmette at the helm, who really pushed this forward, we know how important it is for the early development, but now we even know how important it is for the end development in later years, the craniofacial development of the maxilla. So I want to say thank you, Shelley Marmette, for your pioneering, your spirit, everything you have done tirelessly to open up the medical world to the importance of breastfeeding and also to professionalize the lactation consultant profession in the world. Thank you again. Here's to Shelley Marmette and everything you have done to bring this movement forward.
Okay, to Shelley. Woohoo!
Yay, Shelley.
So Shelley regrets not being able to be here today. She actually had a medical situation and was in the hospital very recently. So we wish her a speedy recovery. But I'm so honored to be able to present to her the AAMS Sir William Osler Award for Lifetime Achievement in Clinical Practice and Education. So Sir William Osler, if you don't know, he's probably, perhaps beyond Hippocrates, the most famous medical person in history. He's credited with having created medical specialization. He's one of 4 doctors who founded the Johns Hopkins Hospital. He was born in 1850 in Canada. He passed away in 1919 in Oxford, England. And some of his quotes: listen to your patients. They are telling you the diagnosis. Imagine a baby screaming, saying, I'm tongue-tied, you know, I can't feed. Or, you know, a child acting up with ADHD because they're not getting sleep. You know, your patients are telling you. The practice of medicine is an art, not a trade. It's a calling in which your heart will be exercised equally with your mind. So we have to remember to keep passion forward. And we have the heart image here in some of our virtual backgrounds. I mean, it's such a beautiful quote. Really, Shelley helped pioneer this incredible application. And when we were so lucky, the AAMS, to have our foundational strategic meeting at University of California, San Diego, we had assistance from a foundation called the Center for the Health Professions at University of California, San Francisco. It was founded with $20 million from Gordon and Betty Moore, who wanted to advance healthcare. And they gave us a white paper support, and they looked at what are the pathways forward. And one of the ones that their research team identified was lactation consulting, interdisciplinary, international, both postgraduate specialization of professions and a specialty on its own. So we still see that as a guiding light and moving forward. But anybody want to say anything about Shelley?
Oh, Joy does.
Okay, Mom.
I just wanted to say that Shelley is an amazing person, because it all began for her in the 1970s when her baby wouldn't take a bottle. And I just learned of this story of her, how she started. And she thought she was a speech pathologist, thought she would be going back to work right away and not have to breastfeed her baby. The baby had, this was her first child, and the baby couldn't latch. And so she reached out for help anywhere. This was in the early 1970s. And she found the lactation was so necessary because she wasn't getting the help she needed from other mothers helping mothers. And she actually conceptualized, after she learned from her own experience how difficult it was and how she reached all these roadblocks on her own body, how to make it happen. And what she did was pioneered the whole field of lactation consulting in the world, and went out into communities, universities, educated. And like all of us in a new kind of field like myofunctional therapy or sleep medicine, we reached many roadblocks, and she has overcome them. And I'm just so proud to be a close best friend of hers. Thank you, Shelley, for all your perseverance and hard work of traveling all over the world and doing your best to professionalize lactation consulting.
Thank you, Joy Muller. Am I muted?
Thank you, Joy.
Okay, thank you very much. So, Shelley, we love you. Get well soon. Can we have those slides come up, please? Okay, great. I want to go through the next few slides we have here today, and just give a shout out to the World Sleep Society. They've been such an amazing partner society with us. We had our first joint meeting with the World Sleep Society in Prague 3 years ago at the World Sleep Congress. We had an amazing meeting, a joint meeting with the AAMS and World Sleep Society at the World Sleep Congress in Vancouver last year. And we both times had standing room only. We had to turn people away. And they've been so wonderful in kind of helping us get up. And they reach out around the world in helping societies drive a mission of helping people around the world. They have over 70, I believe, member societies around the world, like the American Academy of Sleep Medicine, or the British Sleep Society, or the Indian Sleep Society, or the Chinese Academy of Sleep Medicine, or the Chinese Sleep Research Society, these member societies. So I want to just share, our partners are having a virtual meeting to keep things going, keep present, because their next Congress was postponed, which was going to be. So this is going to be online, December 3rd to 5th, 2020. So worldsleepcongress.org or worldsleepsociety.org. Please go ahead and take a look at this information. Next slide, please. And our next Really, I'm so excited about this meeting. I love this meeting. The International Pediatric Sleep Association is another world body that the AAMS is a partner of, going back several years, but we've been involved. We were formally invited to participate in the Congress in Taipei, Taiwan, also in Paris, France. We had an amazing time 2 years ago, and we were gonna be in Brisbane next month, but the COVID came on, and we're gonna have an amazing meeting. Go to pedesleep.org and register for this meeting. It'll be so exciting. I'm on pins and needles, can't wait to hear about our submissions, but we're gonna be hearing next week. Go forward, please. So World Sleep Day is next on the calendar, March 12th, 2021. I am going to be calling upon all 27 now of our nonprofit scientific societies that the AAMS has helped incubate or launch around the world, and have activities around myofunctional therapy screening and screening for myofunctional disorders as it relates to sleep disorders. So I want to see a tremendous World Sleep Day activity. I want everybody to go to worldsleepday.org and register. We will be sending out information to all the Congress program people. And for those who are joining us, just, as, kind of guests online on YouTube or our Facebook page, we'll be putting out information there too. So there'll be a lot of exciting details. So, which leads me to our next announcement. We don't have a slide yet, but we were going to have our 6th Congress September next year in Rio de Janeiro with the World Sleep Congress. And I've got an announcement. Go ahead, put the next slide on. It was going to be in Rio de Janeiro, but there was a switch. So the World Sleep Society just last week announced the next World Sleep Congress is actually not going to be in Brazil, Rio de Janeiro, Brazil, but in Rome, Italy, where it was going to be in 2023. A lot of moving pieces, shuffling the deck. So we were invited to be a part of this. So, but we didn't want to wait 18 months to have our next Congress. So we're going for 2, baby. We're going to have another virtual meeting, our 6th AAMS Congress. More details will follow. Will be August 1st to October 1st of 2021. We're going to have a push that goes out, discounts for members to register, lots of exciting details. We'll have even a bigger presence, and it will be a hybrid meeting. So over that 2-month period, because we don't know what COVID will be like, we imagine local people able to get together in groups of 10 or maybe 100. We will have already confirmed meetings regionally that we will film, live stream, and have on record on demand. We will have meetings in Berlin, in Hong Kong, in Sydney, Australia, in Rome, Italy, in Paris, France, in Barcelona, Spain, right here in Los Angeles, California, in London, England, and in Oslo, Norway, and in Brussels, Belgium. So those are the cities already confirmed. It's going to be virtual beyond. That is the name and the theme, and stay tuned for more details. But we will then have our 7th Congress in conjunction with World Sleep in Rome, Italy, March 11th to 16th of 2022. Go to the next slide, please. And there is a chance we will have our 8th Congress right here in Los Angeles in the fall of 2022 with the International Pediatric Sleep Association. So that's to be announced, to be determined. Could be very, very exciting. But we do have it confirmed that we will have our 8th or 9th Congress in conjunction with World Sleep Society, World Sleep Congress in Brazil, in Rio de Janeiro, where Samantha and I actually married 8 years ago. So in 2023, it'll be our 11th anniversary.
Yeah. And just so you know, 23 is a synchronistic number of the universe. So if you're born on the 23rd, and if you have 2023 in your world, you have a special magnetic field around you. 2023. Let's get it better than 2020, shall we?
Yeah, here. And Candomblé, a local religion there, is very special. So here is to the next AAMS congresses, the next 3, perhaps 4 congresses, but certainly we've got 3 on the books already. Here's to it.
All right, everybody.
Rock and roll.
Gallery.
Wait, we've got another announcement, the EPOS film. As we've mentioned, we've had some teasers. We've had teasers, and really the thrust of this Congress has been intervention for the largest number of people at the earliest possible age, myofunctional orthodontic intervention. Patrice Bergeron, and we have Kevin Boyd, co-presidents. Ayala Boatzer is a board member. Samantha Weaver is a board member. I'm executive director and board chair, and board member Katrina Rogers is a board member. Paola Pirelli is vice president for research. We have Patrick Fellis, who is vice president for scientific affairs. He sends his regrets. He could not be here today, but these are all dear friends. We've got 17 members of the board. We're so excited. The AAMS is proud to incubate this. The AOMT, Samantha and I have an institute that we help lead here based in Los Angeles, is happy to contribute. We're going to have some exciting news because all 4 of these congresses, we've gotten approval from our partner societies at the International Pediatric Sleep Association, the World Sleep Society. They're respecting host societies, the Italian Sleep Association, the Brazilian Sleep Association, also what will likely be the IPSA Congress here in Los Angeles is the co-sponsoring organization will be the California Sleep Association, and the incoming president, Rafael Palaio, who we love. Yo, Rafael! It's all been approved. So IPSA will be able to have its first 4 congresses, just a juggernaut of a slate. We've got strategic alliances already on the books with the International Association for Pediatric Dentistry, the European Academy of Pediatric Dentistry. I'm getting a hook here, tapped on the leg.
I want to just contextualize why these meetings are so important. If you haven't been to these meetings, it's not just a club, but what it really is a collective. And what happens at these meetings is that the science is shared. So earlier in the opening panel discussion today, we heard from Brian and also from Harold, who talked about the resistance. And what these meetings do is introduce these concepts and this knowledge so that it doesn't just it's not just some research or scientists or clinicians that are not relevant. So these meetings are really about moving the needle, bringing people together, and also that other people can join the conversation. So that's why these meetings are so valuable in the advancement of myofunctional sciences, and why our alliance with them is such a powerful push forward.
To alliances, to scientific collaboration, and to having fun and doing it with style. So if you want to play that video, this is just a little video. You can see Mayor Krieger, Patrick Fellis, friend of mine, Antoine Kendis, who helped, Patrice Bergeron. We got together at the New York Athletic Club and the Knickerbocker Club in New York City, late November, early December, planning. We had about 30 people contribute, in Hidehiro Abe, who's on the board, Katrina Rogers remotely. There's a paperwork that we filed in Geneva this week. We registered this society. We're so excited. We really feel like we're onto something historic here, because there's no society in the world that has orthodontic intervention at the earliest age possible, which could be at birth. So we are really excited to get this up and running. And we want to make a call out next week to you guys, becoming founding members of the society. We have so much important work to do. So the AAMS will be like a big brother to EPOS, and we're really excited about great things together. And I don't know if our founding co-presidents want to come on and say something, or any of our other board members for EPOS. Patrice Bergeron, I know it's late and you've got little kids pulling at your jacket. And Kevin Boyd, I know you've got a daughter there. You've got
he's been in his
father
car
done,
this whole time.
daughter time. You've got a surf instructor maybe waiting for you.
Oh my gosh.
You guys go ahead, please talk.
Patrice, I'll follow you.
My pleasure. You're really all welcome in Geneva. You know, I think Geneva could be interesting because as we need to go to the government and to say yes, what happened is really we've changed the vital function of the children and the future generation. You know, we really changed the vital function. You know, and what we see is the myofunctional therapy, is the orthodontic treatment. But at the end, you need to try to breathe the air by your nose. You need to change. You need to work with your occlusion, with your tongue. You need to do by yourself. And after we have some little appliance, and after there was orthodontic, myofunctional, there is many therapists that can improve the life of the children, not only the face, the occlusion, the therapy, the life of the children for today and for the future generation. So really, we have a good action, and really, when you see Mark and Samantha, you know, they have so many energy. I don't know what they are doing. You know, they are beautiful. They speak all the language. They are crazy guy. You know, they always focus about it, and you can do nothing in your life without people who is working all the time on your vision, because we are working in our clinic, you know, and really it's like not we have no time, you know, but it's many time, you know. It's impossible to find people just near you who work a lot like Samantha and Mark, and really I'm really happy to know you, you know. It's just 1 year, but when I see what you are doing all the time, and really you are beautiful all together, you know. You have your smoking, I love your style. And if we need to change the life, we need to find a new style. And Samantha, the style you done on the movie, the you know, like the photo is on the back on the screen, you know. I love it because I know it's a lot of work, you know. You cannot find that today. It's really a lot of work. You need to focus on it all the time. So really, Mark and Samantha, you help us. You help our profession, and you help the health of the world for today, you know. And it's not so easy. It's not so easy to do it, you know. It's a vision, but without you, we cannot do nothing. So we are all together in the IPOS, but really, I want to thank you for all what you do. I'm happy to be with you, Kevin, because I love you, guy, and you know what I love. I love the guy who the people who are working. You know, I see you are busy. You're always in your practice. You have the patient, and you know, at the end we have many patients. We see it. So I see Paola is the same. You know, you always focus on it. You send me so many messages about this patient. You know, Katrina, I don't know how she's doing. You know, she's on the EPOS. She's all the time in all the presentations. So she wants to change the world. So Joy, I'm happy to see you, but I think we don't need together. They will Jill. I see that you smile all the time. You are happy about all what we say when you cannot speak, you know. But really, we are all together. I'm just not the president, you know. We are all the president and just a part of the society. But I'm in Geneva, so I think it's a good way to explain to the world that in Geneva there is the many health organization. But you know, in my mind, it's to say yes. We change the face of the children. It's really an handicap. It's an handicap for the life for our own children and for the future generations. So we need to explain to all the people in the world that we see that on the face, you know. And it's really, I love, you know, it's really on my mind, Samantha, to say yes, air is not air, food is not food, you know. I don't know what you find it, and sleep is not sleep. But at the end, face is not face. The face of our children has changed, you know, and we all together work to rebuild this face. It's crazy. So it's really a real problem, and we will focus on it, and that will be yours, you know, if you want that I have this language for the people. And really, when you came in Geneva, it's like your home. You can when you want. You don't need to have an appointment. You open the door. You are the member of the IPOS. You help me. It's like your home. So when you come in Geneva, you come on the practice like it's your home and your clinic. It's for all of you. Really. You don't need to have an appointment for me. You need to be sure you're quiet in this clinic, and we all going in the same way. So really, thanks to all. I'm really happy to be with you.
Cheers, Patrice.
Cheers, Patrice.
That was so
Thank you.
That was so
Thank you,
beautiful.
Patrice.
And
Thank
this is to
you.
Patrice. Everybody, to Patrice.
Cheers.
Thank you. Hi.
Chin,
I love
chin.
you guys.
Class, où est ton verre?
Chin,
Où est ton
chin.
verre?
We love you too.
Thank you.
So I want everyone to understand this heart that you see above Patrice's shoulder is a Qigong heart. I don't know if you know Qigong, but I suggest you Google it, you study it, Qigong.
Qigong.
So Q-I, new word, G-O-N-G. I've spent a lot of time working with Chinese principles, and I've lived in China for a couple of years. So that's the Qigong heart. So I want to give a special introduction to the co-president, founding co-president of EPOS, Dr. Kevin Boyd, who's a dear friend of our family and myself personally. Sometimes he claims he's a mentor of mine. Sometimes maybe, yeah.
I wish. I wish.
Yeah, and he is a tireless advocate. He's a winner of a special award, the Albert Schweitzer Award, for care for humanity that took place at our AAMS Congress this year. And I remember we were talking in a parking lot in Alberta, Canada. We were speaking a little bit early in my journey here, I think 9 or 10 years ago. And we stepped outside of the meeting, and there was a snow-covered parking lot. There were mountains around, and we're sitting there talking. And he's like, you know, Mark, what this is all about, don't you? And I'm like, please tell me, enlighten me. And he wants to share enlightenment everywhere he goes. He wants to share, which is so beautiful. And that's part of the Albert Schweitzer Award, wanting to share to help humanity. He's like, helping the most amount of kids at the earliest age possible. So it started this dialogue, which I feel is like part of a culmination, a blossoming of seeds we planted way back when in this Congress, this beautiful Congress, which has brought so many people together, and really that's the theme of the Congress, helping the most amount of people at the earliest age possible with the least amount of burden. So take it away. I call him Cabo, so short for Kevin Boyd. So take it away, Cabo. Go Cubbies.
Yeah, and I've never called you Mark. What do I call you?
You started calling me
Marco.
About 6 years ago, 6.5 years ago, when we were in Italy. I was in.
What a memory.
Yeah.
What a memory. So anyway, foundational to what really my message, following Patrice's excellent message, is a book that I just reread. It was written 15 years ago and has never had more pertinence than it does now in light of COVID-19 pandemic. It's called The Ghost Map by Stephen Johnson. And it's about the person. He was a medical detective. He was mid-19th century British anesthesiologist named John Snow. And what his relentless, passionate pursuit of finding what was causing a pandemic, the first pandemic in England of typhoid or cholera. And everybody thought it was in the air. And he thought otherwise. And he discovered that typhoid was a waterborne disease. And it was emanating from one pump in central London, where everybody went for the water because it was so clear and pure. And he just didn't give up. Well, the next thing, that really leads to what I want to talk about is something Marco and I were talking about this morning. And certainly, Patrice, your being in Geneva, Marco told me that he knows some people at the World Health Organization, because I oh, Mark, guess what I discovered? You know, they have two initiatives. One is ending childhood obesity. And I posted, and I sent it to Patrice, I sent it to Paola, am I saying your name right? Paola. Anyway, and I sent it also to Katrina and Samantha. You haven't opened your email yet, but you've got two documents from the WHO that talks about not only mitigating and making things better for childhood obesity, which certainly has to happen before you can end it, right? And ending early childhood caries. Well, what I proposed is maybe a first charge for the new EPOS as we incubate within the AAMS, is that we get together our board and maybe draw in other members accordingly to draft a proposal. And Mark he told me he knows people at the World Health Organization has already sort of made some leanings this way. And plus, Patrice, because you're there, how about ending early childhood malocclusion? Now, if a child has a fever, of course you want to end it. And that fever must get lower before it ends. And you hope it will never come back. So I really like this. Boy, let's mitigate malocclusion in early childhood. No, let's end it. And that first means we have to start decreasing the prevalence of it. And in order to do that, just like John Snow did with the cholera epidemic, we have to know what causes it. Well, I am of the mind, and many others are, and it will make sense probably to everybody here, that early childhood malocclusion, that means before the age of 59 months, before 6 years old, if it's non-syndromic genetic syndrome or injury related, it is what's foundational to it is oral facial myofunctional disorder, OMD. Did I say that right, Mark? Is that if we end malocclusion, and that means we start making a dent on this, and you know, we have to know what causes it, just like John Snow had to identify it against a lot of negative pressure from the established medical society in England at the time, that they thought it was airborne. And because the air stunk, that meant no, that was a symptom. It was waterborne. Well, that's really what we have to do, is identify early childhood malocclusion as being an OMD. It's an offshoot of OMD. And I suggest we say that get the World Health Organization to do what they've already laid the framework for early childhood caries and early childhood obesity. We need to end it. And that means we have to start really digging into this. So that's really, I hope that makes sense to people, and that they will, you know, after you review those documents, send them out to other people, because I didn't have everyone's email address. Samantha, you have it. Patrice has it. Paola has it. And Katrina has it.
Thank you so much, Kevin, Dr. Boyd, for your tireless devotion to sharing knowledge, to helping people. Dr. Boyd has a beautiful clinic in Chicago, and he welcomes people from around the world who find him and kind of like coming to scratch at the door to learn, you know, tricks of the trade.
So here's to you. I want to say thank you, Kevin. Thank you for your contribution, your passion, and that big heart. I feel it.
Thank
the
you.
World does.
Cabo.
Here's to you, Kevin.
Thanks, Katrina. Couldn't do it without you.
Thanks, Kevin.
Likewise.
Cheers. Dr. Perella,
Yeah.
Dr. Perella, you are an inspiration to me. I've read everything you've ever written. And
sorry, what did you say? Can you rephrase, please?
I said you are such a huge inspiration to me.
Oh.
And I have read everything you have ever written with Christian, and I can't wait to work with you in research. So it's great.
I'll be honored. I'll be honored. At this point, can I remember a big friend of all of us? I want to thank Christian Guilleminot, because Christian Guilleminot introduced Mark to me, Mark and Joy and Samantha. And I'm really happy for this moment. I feel that this moment, it will be very, very important. I dedicated all my life to treating children, and this society will be really important. We have to collaborate, and early treatment for children for malocclusion by orthopedic treatment in association with myofunctional treatment. This is very important. This collaboration will be very important. So all the best for it.
Here, here.
CG.
Kevin, I just want to say I love you, and I really, really connect with you and feel your passion.
I love you too, Joy.
Big kiss to Joy.
You're
Big
the
kiss.
best.
You are the best, Joy.
Oh, Paola, you are the best.
Wow. Wow.
Patrice, our president is the best.
Thank you, our president. But Mark, I think you need to change the background because you know, with the after all people love all the people. You know, it's like you put on back of the screen.
So just a couple
really
of things, because we've gone beyond our allotted hour. Some housekeeping measures. You know, Kevin, you mentioned Ghost Map. We had a forum on public health, which is on our Facebook page and our YouTube page. We had a picture of Jon Snow featured prominently, but even bigger was Death pumping the water pump, you know, like there in the background. We had a image of a map where he did his detective work, and we had an image of the cover of the book. And I think we're on to something really profound here in terms of public health. I'm so excited. We're looking forward to hearing about the possibility of, we got invited to submit 2 late-breaking symposia for the World Congress of Public Health, which will be in the middle of October. And the scientific committee is going to meet on Monday, so fingers crossed. But they were going to meet earlier, but they're all really distracted with national emergencies in their respective countries about COVID-19. So it's really a crazy time, a special time. And, you know, hopefully we continue on the path of making lemonade out of lemons. And in that vein, I want to make the last housekeeping announcements we had to make. We will also be registering, we are deciding between Brussels and Geneva still, another foundation, the Patient-Centered Outcomes Foundation. It'll be registered probably next week or the week after. And it has 2 public-facing tools. There's called myomd.org, which stands for My Orofacial Myofunctional Disorder. We really want to champion patient voices, patient data collection, interaction, and omdinfo.org. So we want to share this knowledge in the broadest possible way. And we will also be forming, I believe also in Geneva, the International Board for Myofunctional Sciences, which is a clinical competency accreditation board for people who want to practice myofunctional therapy. More details to follow. Very exciting. We're working with a brilliant advisor who's advised the AAMS since its inception, James Stewart, who's head of the credentialing committee for medicine for the American Board of Parliamentarians. Thank you, James Stewart. You've been so generous and amazing in your support. And this will be affiliated, but by the ISO, the International Standards Organization, which is also based in Switzerland, the gold standard, and really the champion of gold standards for business, for enterprise, for medicine. The ISO standard is to have separate a credentialing board for educational competency. So we have the consortium for orofacial myofunctional therapy education, which is also going to be launched in Geneva, Switzerland. and that will accredit people or institutions who want to give everything from a weekend CE class up to an advanced degree, like a bachelor's or a master's or a PhD in myofunctional therapy and myofunctional sciences. And we also have something I'm very excited, which is a personal project. I just acknowledge a little disclosure. We have a foundation that Samantha and I started a couple years ago, the Airway Research Institute, which we registered initially in Estonia for a couple of projects, but we will be registering this foundation in Geneva, Switzerland. So airwayinstitute.org is up there, but we're really excited to share news. We've got so much love to share. Our Qigong hearts. Let's cover the world with open hearts, open minds, open postures, and proper stomathnathic system function. Okay, so anything you want to say to take us out, Samantha?
Well, I just want to say, if you're new to the AAMS, this is a collection of researchers, clinicians, and the public that's dedicated to elevating awareness about myofunctional sciences and what those orofacial myofunctional disorders cause over the lifespan. And you may not know what this is, so I want you to reach out to us personally, aamsinfo.org. You will see a place where you can email us. You'll get the information you need. I am so excited to welcome new people. And while we're closing this initial phase of our Congress, which essentially is the viewing privileges, are closing October 1st, the entire Congress has access until December 31st as you become an AAMS member. So please become an AAMS member. What that does is it gives us the empowerment to mobilize and to continue all of the work that we have done. The white papers need people to come in and contribute. There's organizational positions. There's textual document dissemination. There's so many opportunities that we really do need the membership to step in. And as a member, you become somebody who gets benefits in viewing of the Congress, but also journals. And you'll see more about that on our website. And I just want to say thank you for the support. Thank you for the passion. This is really about elevating the quality of life for humans as we continue.
I want to thank some of the people behind the scenes working. Ren, Victor, can you guys come forward? I want to thank Guillaume Fellis, Patrick Fellis, Baptiste Boutros. You guys come into the camera. We've been in our COVID pod here. Some of our support team, we've had Shannon May, who's worked in our office, Laura, you know,
so many
people around the world. We've had interns in France and here in the US, and our great and famous Congress Secretary, Katrina Rogers, you know, here's to you as
Here's
well.
to you, Katrina.
And thank you so much for everyone's support and all of the love and passion and dedication. Really, we put this thing together on a shoestring budget. We were worried about computers overheating. You know, we had to get a air conditioner in our little guest house here because the computers kept overheating and the screen kept freezing. We've had so many little technical learning opportunities and glitches, and you know, opportunities for us to grow as a couple.
Bit better as co-moderators.
Yeah. So here's to you, Samantha. You have been such a guiding light and force and visionary in your dreams and execution for helping make the world a better place. You've been so incredible as media director and co-chair of this 5th AMS Congress. I love you.
Thank you. Wow, thank you. All right. Love does make the world go round. All right.
I think that's it.
That's going to be it.
That's it. With love.
Our closing video.
Oh yeah, we have a video to share.
And so it's just.
We have a video. Stay tuned. We have a video. Don't drop off. We have a closing video.
So thank you all. And we will not be leaving you. And the Congress is still in full motion action. Please reach out to us personally if you have any questions. AGV CEUs are going to be available on the on-demand platform. And there will be other questions. So please don't hesitate. I'll put up announcements. And we're so happy that you're here. So thank you again.
Of the global coronavirus pandemic.
Closing its borders to foreigners from tomorrow.
In the situation we find ourselves in with the coronavirus, we will suspend the live meeting and we will move to a virtual format.
There we go. Hi, good morning, good evening, and good afternoon. I know people are staying up all around the world to be a part of this.
Completely avoiding, and I want to do everything in my power.
When I met Christian Guilleminot,
Look at the tongue space.
Yeah, the tongue space and particularly the mandibular arc.
Cover something in a thorough way.
The rest of the world needs to know about all of our work and how we're working together.
Welcome you to our forum today.
This is going to drive change.
Myofunctional therapy into the dental curriculum.
7 years of pain and 27 years of dysfunction. Why did none of the other doctors realize this stuff?
My journey is pretty much similar to, I would say, tens of thousands of people out there.
Everything made sense then. It was relieving to know that I wasn't alone, that I wasn't insane, to be having the thoughts that I was having and feeling this way. But I immediately reached out to him.
This Web Congress accumulates strong scientific evidence of the importance of orofacial health.
9 years ago in Bauru. By the way, they have a great sandwich.
We love you. Thank you.
Cheers.
Become involved. We are crying over here and we thank you. This has been an extraordinary experience on so many levels. Mwah.